You already know that from arcus aorta we have brachiocephalic trunk, left common carotid and left subclavian artery, and brachiocephalic subdivides into right common carotid and right subclavian artery. Subclavian artery from the beginning goes to external edge of the first rib. Here it is first rib. That is first rib. And external edge of the first rib. That is the border between subclavian artery and axillary artery. And subclavian artery pass in three departments. Here it is, if you remember, first rib has tubercle where anterior scalenus muscle attach. That is tuberculum musculis scaleni anterioris. And here it is anterior scalenus muscle, and here it is middle scalenus muscle. And space between these two scalenus muscles, that is spatium interscalenus space. That is why subclavian artery, first department, that is from the beginning to enter into interscalenus space, second department inside of this space, and last outside from this space to external edge of the first rib. Clear it is. That is three departments of subclavian artery. In first department we have arteria vertebralis. And arteria vertebralis, if you remember in cervical vertebra, here it is vertebra cervicalis, and cervical vertebra, transverse processes of cervical vertebra has opening, foramen transversarium. Do you remember? Opening in transverse process of cervical vertebra, and arteria vertebralis goes to this opening and pass through them. Here it is, and goes, that is, it goes upward, and near the skull it passes through foramen magnum, goes into the skull, and joined with the same artery from opposite side. Two arteria vertebralis join together and forms arteria basilaris. Then I explain what happened with arteria basilaris. Now we continue subclavian artery. Next branch, it is internal thoracic artery, arteria thoracica interna. It goes to thoracic cage and continues into anterior mediastinum. It gives arteria intercostalis anterior intercostal arteries. They are 6 in number. The same it gives arteria pericardiaca phrenica. It supplies pericardium and diaphragm, and subdivides into two terminal branches. Arteria muscular phrenica goes to diaphragm, and arteria epigastrica superior continues to anterior abdominal wall. Clear? Next, tyrocervical trunk, truncus thyrocervicalis. Truncus thyrocervicalis subdivides into three branches. Arteria thyroidea inferior goes to thyroid gland. You already know that external carotid artery gives arteria thyroidea superior, arteria thyroidea superior from external carotid, arteria thyroidea inferior from tyrocervical trunk, and sometime maybe arteria thyroidea ima from brachiocephalic trunk. That is, if I ask you in time of mini exam blood supply of thyroid gland, you need to answer all of these three arteries. Next branch, that is ascendens cervical artery, arteria cervicalis ascendens. It goes to deep muscles of the neck. And last branch, that is arteria suprascapularis. It goes to dorsal surface of scapula. Three branches in first department. In second department, inside of interscalenus space, it gives truncus costa cervicalis. Truncus costa cervicalis. And this trunk gives deep artery of the neck, arteria profunda colli, and arteria intercostalis suprema, which is subdivided into two posterior intercostal arteries, arteria intercostalis posterior first and second. Two posterior intercostal arteries start from truncus costa cervicalis. And last, outside from interscaleno space, we have transverse artery of the neck, arteria transversa colli. It supplies brachial plexus and some muscles of the neck. That is transverse artery of the neck. That is subclavian artery. Now, internal carotid artery. Internal carotid artery have not got branches on the neck and on the head. It goes into canal, canalis caroticus. This canal has apertura externa, canalis caroticae, pass through carotid canal, leaves canal through apertura interna, and goes into the skull through what? Help me. What is this opening? Foramen? Lacerum. Foramen lacerum. It passes through foramen lacerum, pass laterally from sella turcica in carotid groove sulcus caroticus, and near of optic canal it gives first large branch, that is ophthalmic artery. Arteria ophthalmica goes into the orbita, and it is subdivided into branches. They are arteria centralis retina, goes to eyeball, arteria ciliaris, the same, supplies eyeball, arteria palpebralis, medialis and lateralis, goes to eyelids, arteria lacrimalis goes to lacrimal gland, arteria supraorbitalis goes to the skin of forehead, arteria ethmoidalis, anterior and posterior, pass through ethmoidal opening, foramen ethmoidale, and they goes to nasal cavity and supplies mucous membrane of nasal cavity and supplies the same dura mater in anterior cranial fossa. As the same heat is rami muscularis to muscles of eyeball. Well, they are branches of ophthalmic artery. And after that, internal carotid artery goes upward, goes to the base of the brain and supplies brain. And now you need to draw this diagram. It is only for your understanding, but now I will draw diagram what you need to draw next time. That is internal carotid artery, arteria carotis interna, and it is the same, internal carotid artery, and it gives arteria cerebri media, then arteria cerebri anterior, then arteria communicans posterior, and arteria choroidea. It is arteria cerebri media, arteria cerebri anterior, then arteria communicans posterior, and arteria choroidea. Maybe in your manual that is arteria choroidea posterior. That is correct. It is correct name. And between both anterior cerebral artery we have communicating artery, arteria communicans anterior. Arteria communicans anterior. They are branches of internal carotid artery. Now, look here, that is two arteria vertebralis joined together and forms arteria basilaris. Here it is arteria vertebralis, it is arteria basilaris, and arteria basilaris subdivides into arteria cerebri posterior. Arteria cerebri posterior. And what we can see, we have a cycle on the base of the brain between branches of internal carotid artery and branches of vertebral artery or arteria basilaris. That is Willis cycle or circulus arteriosus cerebri. And the same we have from arteria basilaris, arteria cerebelli superior goes to cerebellum, arteria cerebelli inferior anterior, and arteria cerebelli inferior posterior from arteria vertebralis. It is the same superior cerebellar artery, inferior anterior, and inferior posterior cerebellar arteries. These two arteries join together and forms arteria spinalis anterior and arteria spinalis posterior. They are paired. That is why spinal cord has 3 arteries, anterior and 2 posterior. Cerebellum, the same, 3 arteries, superior, inferior anterior, and inferior posterior. And large brain, cerebrum, has arteria cerebri anterior, arteria cerebri media from internal carotid, and arteria cerebri posterior from arteria basilaris. This diagram you need to draw next time. Well, now let's go to the museum. Let's go with me. What is it? Sternum we removed, the same clavicle removed. It is first rib. What is this artery? This one. It is not so clear. Just well, again, that is arch of aorta. That is why here brachiocephalic trunk, that is left common carotid artery, and here it is somebody take it, this table, no? Okay, and here subclavian artery. On the left side, it is right subclavian artery and right common carotid artery. Okay, it is. And now we speak about subclavian artery. About subclavian artery. Look here. This artery, that is arteria vertebralis, and arteria vertebralis goes to transverse processes of cervical vertebra. Now I remove common carotid artery, and you can see that it goes to transverse process of cervical vertebra. Look here, I remove 6 cervical vertebrae. It passes through transverse process. Is it clear? It is clear? Okay, that is arteria vertebralis. It is arteria vertebralis. And next we will see how it joined together with the artery in skull. Now, what else? Here it is tyrocervical trunk, truncus tyrocervicalis. And here it is internal thoracic artery, arteria. Yes, it is. No, sorry. Internal thoracic artery, arteria thoracica interna. And this artery gives arteria intercostalis anterior. They goes to intercostal spaces. Arteria intercostalis. Then what else? Internal thoracic artery. Here it is. Continuous that is here it is continuation of internal thoracic artery, that is arteria epigastrica superior. Superior epigastric artery goes to anterior abdominal wall. What else? Thyrocervical trunk, and thyrocervical trunk gives inferior thyroid artery, arteria thyroidea inferior, here it is. The same, it gives arteria suprascapularis, this one, and arteria cervicalis ascendens, here. Arteria cervicalis ascendens. This artery in this corp, arteria transversa coli, the same start from thyrocervical trunk, but in most cases, transverse artery of the neck, arteria transversa coli, it starts not from thyrocervical, but directly from subclavian artery. But here it is from thyrocervical trunk. That is variant of human anatomy. And last branch from subclavian artery, that is costocervical trunk, truncus costocervicalis, and this trunk, it gives arteria intercostalis suprema, which subdivides into two posterior intercostal arteries, and deep artery of the neck. Where is it? Deep artery, deep cervical artery, arteria cervicalis profunda, deep cervical artery from truncus costocervicalis. They are branches of subclavian artery. Now, what about so okay, that is spinal cord. It is spinal cord. That is brain. It is arteria vertebralis. This one, arteria vertebralis, that is vertebral artery, and arteria vertebralis from one side joined with vertebral artery from opposite side, and together they make what? Arteria basilaris. And here we can see like two arteries joined together and forms anterior spinal artery, arteria spinalis anterior. Here it is, arteria spinalis anterior. And this one, I think here, that is posterior spinal artery, arteria spinalis posterior. In this case, it starts from inferior posterior cerebellar artery. More frequently, it starts directly from vertebral artery. Here it is, arteria cerebellaris inferior posterior, goes to posterior inferior surface of cerebellum. Then from arteria basilaris we can see inferior anterior cerebellar artery, and here it is superior cerebellar artery, arteria cerebellis superior. And then after that, arteria basilaris subdivides into right and left posterior cerebral artery. And posterior cerebral artery, with the help of arteria communicans posterior, joined with what? With internal carotid artery. And internal carotid artery gives arteria cerebri anterior, here it is arteria communicans anterior, and here it is arteria cerebri media, arteria cerebri media. Have you got any questions? No? Well, this way it's more clear to see. That is here, that is anterior cerebral artery one side, that is another, and between them anterior communicating artery. Here it is posterior, here cerebri media. Only here I cannot to see arteria choroidea. maybe it is necessary to cut some levels to if you want to see arteria carotid. Don't know how to do it. Arteria carotid. No. No. No, what is? No. Okay, maybe next time. Well, if you have not got any questions today that is all. You may be free.